Welcome back, fellows in training. My name is Reza Karimianpour from the Medical University of South Carolina. I'm here with Dr. Richard Krasuski at Duke University. And Dr. Krasuski, in terms of patients with congenital heart disease and pulmonary hypertension, what are some things that fellows in training should be cognizant about in terms of new and upcoming research in this field and recognizing such patients in clinical practice?
That's a great question, Reza. You know, it's a very common problem. It's probably about 10% of all patients with congenital heart disease have pulmonary hypertension, and as a consequence of that, they have increased morbidity and mortality. They can be pretty difficult to recognize, and you know, the thing about congenital patients, they often don't complain very much, but if you start looking and you're doing exercise testing, things like that, what you recognize is that in fact these patients are pretty functionally limited. And so you got to do very careful testing, whether that's echocardiography, whether that is doing stress testing to actually see what type of functional limitations they have, and then you're much more likely to pick up problems like the presence of pulmonary hypertension. Now, in terms of some of the cooler areas that we're looking at right now, you know, we've known for a while that you can now treat with medications designed to treat pulmonary hypertension. That was a novel idea, particularly in the Eisenmenger population. If you go back a number of years, we were worried about treating the Eisenmenger patient, thinking we could make them unstable. As a matter of fact, we were worried about them becoming worse cyanosis. That was a big deal. And it was the BREATHE-5 study many, many years ago, now published in 2006. But that's really taken off, and there have been a lot of studies, not only in the Eisenmenger population, but in those patients who have had corrected shunts, or even those with open shunts. Now, there's still a lot of patients we don't know about. Probably one of the biggest group are those people with things like segmental pulmonary hypertension, or complex patients with pulmonary hypertension, those patients where they have single ventricles, things like that. But those are probably the coolest area. And then the Fontan population, I think, is very interesting as well, because the Fontans don't traditionally get what we call pulmonary hypertension, right? Because they don't have a functioning right ventricle, so they can't generate that kind of force. But if they develop an increased pulmonary vascular resistance, that can decrease their output from their right side, and it can decrease the cardiac output systemically. So in those patients, particularly the ones who have an increased pulmonary vascular resistance, even if it's slight, there's an idea that maybe we can reduce that resistance with some of these medications and possibly improve their outcomes. So it's a really hot topic, exciting area.
Excellent. Thank you so much for that excellent summary, and thank you for your time. And fellows in training, if you're interested, see us on YouTube at FITsOnTheGO channel for more videos like this.